Good morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to try to talk to you this morning about doing orthodontics on older patients. And I said age 70 and over, and 70 isn't the end. In other words, you could move somebody's teeth, I assume, till they're 95 or 100. If you just took time and they had good bone structure there, you could move the teeth right along. So, and there's a lot of people that have had a lot of dental work done and bad teeth extracted, and they have partials and different things, and you just have to be kind of innovative in things you want to do to these people. So just watch what we do here with this a real nice looking older lady, and she is quite capable of correcting this, and so she sees she's got a kind of a fullness in the facial structure. Put her teeth are in a class 3. She's got cross bites in the anterior part of her mouth that she's had all of her life, and I'm sure that bothered her a great deal. So she's having the rest of the teeth extracted except the front teeth up here, the 6 upper front teeth, and then down on the bottom she's got about 7 or 8 teeth that she's keeping down there. And she came in with this problem of the crossbite, and we've already started her, and we got her in braces right here to bring those teeth across, and you can move adults just like anybody else. It doesn't matter. They just don't have any problem there. So here is the what you do. You work with a man who is going to do the restorative work, and you have to convince him that you can do certain things. Now we want to bring these teeth out. I'm sorry, I jumped the gun there on that. Let me get back to where I was. We want to bring these teeth forward. Let me go over here and do that. Alright, just these teeth right here. We want to bring them forward and jump them over the bite. And so we don't have any teeth back in the side here to push against. In other words, if you push something out this way forward, you got something going back in the back direction. So we had to take an upper partial that she was wearing, and we had it fit around these teeth pretty tight, and we used those at anchorage. And we built a little spring that I want to show you how to use, and you put that in behind those teeth and baste it in the appliance you would come back in that she was wearing. So we put the arch bar in there. In other words, here is these teeth would bring these 8 out, but I didn't want to bring these back too much. So we're getting part of our anchorage from the back side, and we'll be pushing these teeth forward from behind the front teeth. I'll show you in a minute. We've got to move these teeth on well down here, see? And so we have to come in here with something. And we've got an appliance that she's wearing, and it fits pretty tight back up in this area. So we put these little springs on this appliance, and that moves the teeth forward. So she puts her upper appliance in that she's wearing. We put an acrylic base on it so it bites into the teeth, and that keeps it solid. And we take these little springs like that, and they're real simple to make. I'm going to just go back here and show you how we make them. You can go like this, come over, come up this way, and you come down with the tail end of this and you can embed this, and you can straighten this out, you see, and you can end up with this ended up like this. So you can watch that, and it pushes the teeth forward. So we put it in like that, and this is pushing on these teeth. And that's pushing back on this, but it's stable enough to where it can be pushed back, and it'll open this up, and we're going to line these teeth up across here. Now, if you're working with somebody that's doing the restorative work, then you have to work and do things together, and he has to know a few things himself. And we get this in there, and then you can, actually I got the leg down here wrong. You come up like that. And now you can straighten this deal out, and it pushes this, and then you move it the other way, and you can have this angle however you want to, and move the teeth forward that way. So we go, and here the springs are conditioned. You take it each time, pull this out a little, this a little bit, and you move this wire out, something like this. You don't want to move it so far that it pushes this thing out of their mouth, but you move it some, and then it gradually pushes on these teeth until they'll get them out there. And we come back. Now she's got her lower partial and this upper one she's wearing, and she's pushing on these teeth, and these teeth are worn off on the front. Now they're a little closer to jumping over the bite. Now the springs are like this, whereas this was down here. Came up, and you move this forward. You can move the wire in the middle forward and keep it straight. You can pull this up or down to remove that, and you can go up and down in this and get it where you want it. If you want to push more on this, you'd have this wire coming at an angle. Now we just put this in just enough that it doesn't push this out of the mouth or push it down, and so we continue that. And now we get the teeth over the hump. That's the way. And we take those teeth here. Restorative man will build these teeth up, fix them for you, and for the lady. And now they're going to extract these teeth back on the back. And that's what she wanted done. So we open these springs to this length, you see. So learn how to use those springs. You just come up on this side, and you can push them in the way you want to there. Thank you a lot. And he made a new lower partial to hold these teeth in place, and then the upper teeth went over the top. And this is doing mixing orthodontics and restorative dentistry. And there are literally thousands of adult patients out there that can well afford to have this done, but they're not being told that it can be done by their regular dentist. So I hope that a lot of dentists look at this and see that you can come in here and do restorative dentistry, with you mix orthodontics and restorative dentistry. Get to know the guys that's doing the restorative and teach them something about orthodontics if you need to, and you can work together and do a lot of things that you couldn't do otherwise. thank you for watching this, and maybe you get a good idea. The world is full of adult orthodontics that needs to be done, and many people would be glad to have it done. Thank you for watching. That's the two partials going in, and that's the teeth. They're over the hump now, and that'll stay there. So thank you for watching, and I'm going to sign off right now, and I hope you'll join our group and subscribe to it.